Hello and welcome to Health 247 on Rapid Television, where we keep you informed on important health issues affecting our everyday lives. In today's edition, we shine the spotlight on hypertensive retinopathy, a condition that affects the eyes of people living with hypertension and has become a growing cause of preventable blindness. I am Josephine Bitrus. Thank you for staying tuned. Hypertensive retinopathy is an eye condition that occurs when high blood pressure, also known as hypertension, damages the tiny blood vessels in the retina, the light-sensitive tissue located at the back of the eye. The retina plays an essential role in vision by converting light into signals that are sent to the brain. When blood pressure remains elevated over time, it can cause narrowing, leakage, or blockage of these retinal blood vessels, leading to vision problems and, in severe cases, permanent vision loss. We'll be discussing how high blood pressure affects eye health, the warning signs to look out for, and the steps you can take to protect your vision. Stay with us. Hypertensive retinopathy is an eye condition caused by prolonged high blood pressure, which damages the blood vessels in the retina. Risk factors include poorly controlled hypertension, diabetes, smoking, kidney disease, high cholesterol, and old age. In its early stages, the condition may not show symptoms, but as it progresses, patients may experience blurred vision, headaches, reduced eyesight, and double vision. During eye examinations, doctors may detect narrowed retinal arteries, bleeding, cotton wool spots, and swelling of the optic disc in severe cases. The condition ranges from mild to malignant stages depending on the extent of retinal damage. If left untreated, it can lead to vision loss, optic nerve damage, stroke, and heart disease.
Hypertensive retinopathy is when there is gradual destruction of blood vessels that are located at the back of the eye, called the retina. So what happens over time is that when there is increased blood pressure in blood vessels, the blood vessels at the back of the eye become affected, and over time there will be loss of vision in the affected eye.
Hypertension causes vasoconstriction and sclerosis of retinal arterioles, reducing blood flow to the retina. Over time, increased pressure damages vessel walls, leading to hemorrhages, exudates, ischemia, and sometimes swelling of the optic disc.
So when there is increase in blood pressure that has not been controlled over a long period of time, what happens is that the blood pressure will begin to compromise the lining, the vessels, the blood vessel, the lining of the blood vessels located at the back of the eye. So when that happens, it will gradually harden. Now, when I talk about the blood vessels, I'm talking about the arteries and the veins. So for the arteries, there's going to be gradual hardening of the arteries, which will also cause some kind of stress that will reduce the blood flow that gets to the back of the eye. So the blood supply to the back of the eye will be greatly limited or even compromised in the process. And that could, gradually worsen vision, and then the patients begin to complain that they cannot see properly in that eye or in the affected eye.
Fundoscopic findings include arteriolar narrowing, arteriovenous nicking, copper or silver wiring of arteries, flame-shaped hemorrhages, cotton wool spots, hard exudates, and papilledema in severe cases. Hypertensive retinopathy is commonly classified using the Keith-Wagner-Packer system into 4 stages. Grade 1 shows mild arteriolar narrowing. Grade 2 includes AV nicking. Grade 3 adds hemorrhages and exudates. And grade 4 includes papilledema.
So, characteristic fundoscopic findings in hypertensive retinopathy, we normally, when the ophthalmologist uses the ophthalmoscope, which is a special instrument for visualizing the back of the eye, what the ophthalmologist is expecting to see are those flame-shaped hemorrhages because of, when blood leaks out of the blood vessels into the retina. So that's one of the things they see. Another thing they see are the cotton wool spots because of lack of oxygen in certain areas, especially the optic nerve fibers. So you begin to see whitish spots here and there, which we call the cotton wool spots. Then another thing is that because of the increase of blood pressure, we are going to be seeing the arteriovenous nicking, where a hardened artery begins to crush the vein that is directly under it. Also, we would see the optic disc swelling, which we call the papilledema. So these are the characteristic fundoscopic findings that the ophthalmologist would see in a patient that has or presents with hypertensive retinopathy. So when we talk about the classification of hypertensive retinopathy, we use the grading system. Now the grading system is into 4 categories. We have the grade 1, which has to do with the increased pressure in the blood vessels, resulting in hardening of the arteries. So for grade 1, that is what happens. You just see hardening of the arteries. The arteries become very hard and very stiff. Now for grade 2, these hardened arteries now begin to impinge or press on the veins that are located directly below. Now in a normal in a normal retina, or in a retina of a normal patient who has no hypertension, what happens is that there is normal crisscrossing of the blood vessels. So you see arteries going over veins normally. But for hypertensive retinopathy, for grade 2, what happens is that these hardened arteries now begin to press against and crush the veins, which we call arteriovenous nicking. Now for grade 3, because there is compromise in the blood flow, because there is reduction of blood supply to aspects of the eye or to the back of the eye, so what you see are flame-shaped hemorrhages. The blood vessels begin to burst, okay, and then blood begins to spill into the retina. So there will be hemorrhages here and there. Another thing you also notice is that normally wherever blood flows, oxygen follows, because what takes oxygen to various parts of the body is the blood. Now when blood flow is compromised, of course there's going to be cessation of, there will be abrupt non-supply of oxygen to that area. So you begin to see whitish spots, which we call the cotton wool spots. So those 2 things happen in grade 3. Now for grade 4, we are now talking about the swelling of the optic disc. The optic disc is just the place or the outlet where the optic nerve that is coming from the brain enters into the eye. So when that place begins to swell, then that is grade 4, which is a very, very critical, is a very critical aspect in hypertensive retinopathy. So when I was talking about the grading, classification of hypertensive retinopathy, I mentioned about the grade 4, which is called the optic disc swelling, which we see, also called papilledema. So when that happens, it's red alert. It means that the blood pressure is extremely high. Some textbooks, we call it malignant hypertension. Other textbooks, we call it hypertensive emergency. In fact, the moment an eye doctor or ophthalmologist notices that, it is an indication that this patient must go to the hospital immediately. There is no slowing down, there is no going home. It is a serious emergency. Because if that is not taken care of, it's going to result in loss of function of that eye, or sometimes even stroke. So most times, no doctor will want to play with that sign. It's very imminent. And papillary edema, what does it mean? It means that there's swelling of the optic disc because there's already pressure in the brain. And to relieve pressure in the brain, because due to stroke, what happens is that the brain will now cause fluid to seep into the optic disc at the back of the eye. So by the time we notice that optic disc swelling, it's just an indication that things are already really, really going bad, and that person needs to be salvaged on time.
Hypertensive retinopathy is often asymptomatic in its early stages, but as the condition worsens, patients may develop blurred vision, decreased visual acuity, headaches, double vision, or visual field defects. Severe cases may also present with sudden vision loss due to retinal hemorrhage, macular edema, or optic nerve involvement.
Usually, anything that is associated with hypertension will not necessarily give any sign or symptoms at the beginning. That's the scary thing with hypertension, and that's why it's called a silent killer. However, whenever the patient begins to complain of blurriness, in not being able to see properly, or begins to complain of headache, begins to complain of maybe nausea or vomiting, then it's very likely that the disease has already advanced to grade 3 and 4. So usually in the first 2 grades, there might not be any serious symptoms, but later on, maybe there will be headaches, there's going to be blurriness of vision, the inability to concentrate because of pain. They are not able to see. For instance, they will tell you that they cannot make out faces or fine prints. Then there is already a problem, and those are the alarm bells that are usually very imminent, or what we look for.
Cotton wool spots are small, white, fluffy lesions seen on retinal examination that result from microinfarctions in the retinal nerve fiber layer caused by reduced blood flow. They indicate retinal ischemia and are commonly associated with severe or poorly controlled hypertension, diabetes, and other vascular disorders.
Cotton wool spots are the findings we see when there is a retinopathy as a result of hypertension or uncontrolled hypertension, high blood pressure. The indication of the cotton wool spots is to let us know that there are some places that are already lacking in oxygen, and if nothing is done about it, it will result in damage of the optic nerve. Now we know that for the eyes to be able to interpret, for the eyes to be able to interpret what it's seeing, signals are sent from the eye. Usually when the eyes view an object, they are actually seeing light rays that go through the eye to the back of the eye, okay, through the lens to the back of the eye. So what helps us to know what object we are actually seeing is when the optic nerve carries those light rays, takes it to the brain, and interprets those light rays into objects for us, and then sends back signal to the eye. So when we see cotton wool spots, it means that there's already gradual damage to the nerve fibers of the eye. So even if the eye is looking at an object, it might not be able to interpret what it's seeing because there is no nerve fibers, or there's no nerve, optic nerve, to be able to transmit the light rays, or to be able to transmit and let us know that, okay, the eyes is looking at this specific object. So when we see those cotton wool spots, it's giving us a signal that, okay, there is something wrong, or there is gradual damage to the optic nerve fibers.
Diagnosis of hypertensive retinopathy is made through clinical history, blood pressure measurement, and fundoscopy or retinal examination using an ophthalmoscope to identify characteristic retinal vascular changes.
Normally, when we want to diagnose hypertensive retinopathy, the ophthalmologist, who is the eye doctor, is the one responsible for carrying out that test. What they do is that they will give an eye drop that will help to dilate, dilate the pupils of the eye, so that they can use an instrument which we call the ophthalmoscope. It's just like a flashlight that has a magnifying lens that helps the ophthalmologist visualize the back of the eye once the pupils have been dilated. So they are able to see the retina very clearly, the blood vessels at the back of the eye, the optic disc, to know how they are functioning, if functioning well or not. So usually that is how it's diagnosed, and it's a very painless procedure. It's a procedure that doesn't even take up to 5 minutes of the time, and then it's very painless, very seamless, and straight to the point.
Hypertensive retinopathy develops due to persistent elevated blood pressure causing vasospasm, endothelial damage, increased vascular permeability, and arteriosclerosis. These vascular changes reduce retinal perfusion and lead to ischemia and leakage within the retina.
Okay, for arteriovenous leaking, it tells us that there is already damage to the blood vessels. It also tells us that very soon it's going to result in a stroke. Now, for some people, it's a signal that the patient might eventually end up with a stroke. A stroke, yes, a stroke in the brain that might even cause paralysis on one side of the body. So this helps us to know that, okay, we need to really check, what is really going on and arrest the situation before it goes worse. It also gives us an idea that this patient might also, lose the vision in the affected eye if that is not checked on time.
Complications of hypertensive retinopathy include vision loss, retinal vein or artery occlusion, optic neuropathy, macular edema, and an increased risk of cardiovascular events such as stroke and heart disease.
So when we talk about complications of hypertensive retinopathy, we want to talk about what hypertensive retinopathy does to the eye, the effect of it on the eye, and then the effect of hypertensive retinopathy when we are looking at other parts of the body. Now, for the eyes, there is going to be damage. So we have the retinal vein occlusion. Okay, so when that happens, it might even cause vision loss. For some people who are lucky, it might just be transient. For others, it might be permanent. Another thing is that it can cause swelling. So macular edema is very common. It's it can happen. So you see that there will be swelling at the back of the eye. Another one is the retinal artery too will be occluded. And when there is occlusion in the retinal artery, that is what will even result in hemorrhaging. So there will be bleeding into the retina of the eye. It can also cause a situation where there will be vision loss, optic neuropathy. So the optic nerve that is located at the back of the eye gets compromised, and so as a result, they are not able to get signals to the brain to be able to interpret the images that the eyes are seeing. So it can also cause blindness. Now, when we talk about the system, for the eyes to already get damaged, it means that there is already a problem in other parts of the body. Now, we are talking about the kidneys. You see that there is also kidney damage. We are already talking about the brain, where we have stroke. Okay, so the patient can come down with a stroke, or even a heart failure, a heart attack. So these are systemic damages, some of the systemic findings or damages that can happen as a result of hypertensive retinopathy. Remember, hypertensive retinopathy is as a result of buildup of blood pressure. And there are many blood vessels going from one part of the body to the other, which can also affect other blood vessels.
Papilledema in a hypertensive patient indicates malignant hypertension with severe elevation in intracranial or retinal vascular pressure. It is a medical emergency associated with a high risk of organ damage and requires urgent treatment.
Now, the pathophysiology of hypertensive retinopathy is, when there is increase in blood pressure in the blood vessels, because the tiny blood vessels at the back of the eye are very fragile. It doesn't take time for the blood pressure actually to cause damage. So the linings inside the blood vessels, we have cells that line up the vessels. So these cells begin to get compromised in their function and in their structure. And so when this happens, at times it might damage it to the point where blood begins to leak into the retina. Also, if blood does not leak at that time, or some of the blood vessels does not get damaged to the point of leakage, it could harden. They could harden and prevent blood from flowing into the retina of the eyes. And of course, where blood does not flow to, it means that there will not be any oxygen accompanying it. Also, it can also cause a situation where there are clots, in the back of the eye that will also prevent blood from getting there, and then that will also prevent blood from getting there as well as oxygen.
Management of hypertensive retinopathy primarily focuses on controlling blood pressure through lifestyle modifications, regular exercise, healthy diet, stress management, and prescribed medications. Early detection and proper treatment can help prevent complications and preserve vision.
My appeal to us is that hypertension should not cause complication if only we can manage it, if only we can get ourselves checked, if only we can do the right things. For instance, diet control, eating the right diet, exercising adequately, taking the medication that has been prescribed by the doctor, and then getting your eyes checked regularly. So I will encourage us to engage in practices like regular checkup, going to the hospital, visiting the eye doctor. If you have been diagnosed of hypertension, please visit the eye doctor and let them check your eyes routinely, maybe once or twice in a year. And then if there is anything that they are able to discover at the early stage, they can be taken care of before it becomes a very serious problem or it becomes an emergency.
Hypertensive retinopathy remains an important public health concern because it reflects the impact of hypertension on overall vascular health. Increasing awareness, encouraging routine medical checkups, and promoting healthy living are essential steps in reducing the burden of this condition. Thank you for watching Health 247 on Rapid Television. Tune in next week for more. Until then, eat well, stay healthy, and take care. I am Josephine Bitrus.